Agreed that information is one of the most powerful elements in the world, phenomenon or whatever you want to call it. And too often, many of us live our lives and are more depressed and not as profitable in a lot of negative situations because we don't have the information. And part of the mission of a call to action is to impart information into the community in an effort to make our lives better. This is a call to action.
A call to action.
And I'm your host, Alex Habersham. There is a law in and of communication that says, work on me first and us second. Work on me first and us second. And, after having given that some thought for a long time, I submit that may be one of the problems that's causing so much friction and divorces and conflict in our community, in our families, and in our country. Well, one of the mainstays since the beginning, since Columbus came in our country, is marriage. And I think that we all know and look at the statistics and realize that the percentage of divorces in our country is beginning to outweigh and outnumber the number of marriages. So I'm pleased today to be able to have a marriage and family counselor as a part of this show that's going to help to give us some good advice on marriage and what to do maybe and what not to do and what to look for and what not to look for and things of that nature. This is a call to action.
A call to action.
And I'm your host, Alex Habersham. I'm really, really pleased to be able to bring to you, and let me say this very quickly, I'm humbled by the kind of impact it seems that we're having on this community, because we're getting more and more important disciplines and elements of the community inquiring to us and asking us to use a call to action as a vehicle to impart information to the community. And the person that's using this vehicle today is none other than Dr. Darren Moore. How are you, sir?
I'm doing all right.
Thank you. Thanks for coming. Let's begin by telling us a little bit about yourself.
Okay. Once again, my name is Dr. Darren D. Moore, and I am originally from Minneapolis, Minnesota. I completed my bachelor's degree there in African American Studies, relocated to Valdosta, Georgia, where I completed my master's degree in marriage and family therapy. And then I relocated to Blacksburg, Virginia, where I completed my doctorate degree in marriage and family therapy.
You're going to make me get up now. You got to stop now. All these degrees, you're going to make me go ahead. I'm kidding.
So after finishing my PhD, I relocated back to Georgia. I did a little teaching at Valdosta State University until my current position. I'm at Mercer University, so I'm an assistant professor in the Psychiatry and Behavioral Sciences Department, and I teach in the master's program in marriage and family therapy.
Okay. Now talk a little bit about marriage and what you mean. Marriage and family therapy. It's my understanding that a lot of people take the position that can't no therapy help me, particularly people who are married. And it's my understanding that particularly males tend to shy away from therapy. So tell us a little bit about what it is, what it does, what it's intended to do, and the advantages of subjecting ourselves. I hate that word subjecting because that's kind of negative. Participating, in therapy.
Okay, well, first of all, I think there are a lot of misconceptions about what marriage and family therapy is and who it's for. Number one, marriage and family therapy is a process where a couple or a family or an individual can meet with a person that's objective to assist them in addressing pretty much any and all issues within their relationship. And so it could be how do we improve our relationship between a husband and wife? How do we improve our relationships between a mother and a child? We also work in the areas of other mental health, such as substance abuse, such as working with children with disabilities, such as a lot of other aspects. And so I think a lot of times when people hear the term marriage and family therapy, they think that we only work with couples or we only work with families, but we work with individuals, couples, and families. And we're able to assist them in addressing any issues that may be present in their relationship.
Now let's talk about marriage.
Okay. Well, from my perspective, and this is based on the clinical work that I've done here at Mercer, I do work with individuals, couples, and families at Mercer Medicine, which is a private practice, as well as I assist with supervising students in the Mercer Family Therapy Clinic, which is another clinic that offers counseling at a reduced scale or a sliding scale. But in terms of the issues within couples, from my perspective, a lot of it is around lack of understanding, lack of an awareness of who you are as an individual first, and then who your partner is. And so I think what happens is a lot of people get in relationships, and they get in relationships before they're ready, and they're not really aware of what's going on. And so they haven't taken the time to, number one, get to know themselves, and then number two, get to know their partners, so that they can really make a fair assessment in regards to if this person is someone I should marry. And so when I work with couples, a lot of times, some of the things that I see, I always wonder, well, did you not have that conversation before? Or what happened, what happened with that? And so I think that a lot of people get involved very quickly. And once they get married, it's almost too late. And so I think that's one of the main trends. It's just around a lack of really having a deep discussion with their partner.
Would it behoove a couple to go to therapy, because oftentimes it seems like it has a negative connotation maybe, but do you recommend or suggest that, along with the engagement ring, that they should have an appointment, to talk to a therapist?
I absolutely recommend it. I think that it's something that could assist with decreasing the divorce rate. Having premarital therapy can provide a platform for you to really get to know your spouse, to find out what are the things that you like about them and what are the things that you don't really like so much. And then what are we going to do in the event that we have conflict? So how are we going to deal with our problems and our concerns so that I don't feel like I'm neglected in this relationship, like I feel like my feelings are not taken into consideration, which could contribute to other things happening outside of the marriage. I think there is a stigma to this idea of going to ask for help. And we really have to push past that because, as you mentioned, a lot of times people will suffer in silence and they won't ask for help. And then they will ultimately stay and maintain a system of depression, suicidal ideation, and eventually perhaps suicide. I think we have to, it takes a community to put the message out there that mental health treatment is okay. That it is okay to say, hey, I have a problem. And you know what? I am willing, I am courageous enough to go and ask for help. And it's so interesting because I think that people think of asking for help as a sign of weakness.
Right.
But if you really think about it, some of the, I was reading in some article, some of the CEOs of the top Fortune 500 companies, they talk about what set them aside, and they talked about how it's really their ability to say, you know what, I need some help with this. Maybe I'm not an expert in this area, so I'm going to ask someone else to assist me with that. And so asking for help is okay, and it's something that we need to really stress in our community.
Okay, you talked about these clinics. Now, how should one seek help? And and you talked about a couple of clinics and the students and things of that nature at Mercer. But talk about it from an economic perspective too. Is there a sliding scale? Because oftentimes it seems like there's a well, maybe not. I started to say there's a direct relation between income and the lack of therapy and assistance, but it may not be, because there may be some well-to-do people
Okay.
who still suffer from that stigma. Well, I don't need therapy, or whatever. But talk about the resources that are available
Okay.
to individuals and how they can get to them.
Okay.
Individuals who may need, and that's all of us, you know. And then I don't want to take up all your time.
Okay.
But I read somewhere that 75% of people need some kind of psychological or psychiatric help.
Absolutely.
You agree to that?
I agree with that.
Okay.
I agree with that, including people that are in leadership roles, including pastors of churches, including medical doctors themselves, including teachers, professionals. I think that's another piece of it, that we always think, oh, it's those people over there that are struggling with problems. We all, as you mentioned, we all can utilize that assistance.
Okay.
And so in terms of the aspect of socioeconomic status, I do think that is a relevant topic, specifically as we think about all the changes that have happened within the healthcare system and within the insurance industry. And so here in the Macon area specifically, we have, affiliated with Mercer, we have two different clinics. So the first clinic is, and I'll talk about kind of the socioeconomic status aspect. So the first clinic, which is Mercer Medicine, which is a private practice where all the faculty members see patients, including myself. And so I work with individuals, couples, and families, as well as all of my colleagues. We also have other medical specialties. And so that is a clinic that takes insurance. So people who have insurance, they can come and receive services that way. So that's, so I work with professionals, and if anyone was interested in seeing me, they could contact me directly, and I would get them in contact with our scheduling clerk. On the other side, I assist with supervising students in our program that operate a clinic that services people who don't have insurance. So individuals that don't have insurance, as well as individuals that are willing to, that have insurance that don't want to utilize their insurance, that can pay for it. At Mercer Family Therapy Program, it is based on a sliding scale. And so sometimes clients may come and they may pay $1, they may pay $2 a session, they may pay $5, it's all based on income. And so to say that there are no mental health services available in Macon, it's not true.
That's not true.
And so there's lots of other agencies in the community, but in terms of affiliated with Mercer, there is the Mercer Family Therapy Clinic, which is the student-run clinic, as well as Mercer Medicine, which is where I do direct practice.
Oh, okay. I mean, I think it would be greatly beneficial to the community. It is greatly beneficial to just have the knowledge, So let's give us, before we get out of here, the website, the address, and the phone number.
Okay. Well, let me give you the address, because that's most pertinent. We are at 655 First Street, Macon, Georgia. That's 31201. And I don't know our telephone number by heart. And I can tell you, if you want to get in touch with me directly, I can put you in touch with our.
We'll let you
clinic.
get 10,000 calls. Go ahead.
Well, you can get in touch with me. My office number, my direct office number is 478-301-4078. But you can also contact me via my website, which is www.drdarrendmoore or moore_dd@mercer.edu.
All right. Thank you for this. Is a call to action.
A call to action.
And I hope that we've helped people psychologically. Marriage and family therapist at Mercer University. Thank you, sir.
Thank you.